Good day everyone, I am Jacqueline Kumban and I will be reporting about the holistic therapy. Have you ever felt tired even when nothing is wrong? Or experienced stress that affects your sleep and your body? Those moments show that our mind, body, and spirit are connected. Today, we talk about holistic therapy, an approach that understands and treats the whole person. Sa madaling salita, may mga panahon na sabi ng utak mo, okay naman ako, pero ang katawan at emotion mo ay para pang pagod na. Dito pumapasok ang konsepto ng holistic therapy dahil magkakaugnay ang iniisip, katawan at espiritu. In today's world marked by rising stress, burnout and emotional disconnection, the demand for integrative, human-centered care has never been more urgent. This makes holistic therapy a current and critical issue in counseling, not just as an alternative approach, but a potential paradigm shift in how counselors conceptualize healing. Holistic therapy unites both conventional and unconventional mental health treatments to address the individual as a whole. Pinagsasama dito ang traditional na therapy tulad ng talk therapy, medical treatment, at behavioral strategies. Holistic therapy has emerged as a transformative response to this understanding. Unlike traditional talk therapies that center primarily on cognition and emotion, holistic counseling embraces the whole person, the mind, body, and spirit, recognizing that psychological distress is deeply intertwined with physical health, lifestyle, and meaning-making. According to the American Counseling Association, holistic therapy seeks balance and integration rather than symptom suppression, aligning seamlessly with the counseling profession's commitment to client wellness and ethical care. Ibig sabihin, hindi lang ito tungkol sa pag-uusap o pag-analyze na iniisip mo. Kasama din dito kung kamusta ang tulog mo, ang lakas ng katawan mo, at pati ang sense of purpose mo sa buhay. Now, let's proceed with the background of holistic therapy. In terms of providing healthcare, the use of the term holistic dates back to the time of Hippocrates over 2,500 years ago. He believed that it was insufficient to focus on one aspect of the person. He emphasized the importance of establishing equilibrium within individuals. According to Mayer, although holistic therapy has become a popular concept in the modern mental health field, its origin and stand back to several centuries. Early writings attribute its foundational ideas to the ancient Greek philosopher Hippocrates, who emphasized treating the whole person rather than individual symptoms. Holistic therapist Linnea Smith Crawford has observed a growing interest in holistic therapy, particularly since the onset of COVID-19 pandemic in March 2020. She explains that the pandemic has heightened people's self-awareness and understanding that healing is not merely physical or mental, but a combination of the dimensions of the self. Nevertheless, the perception of holistic therapy has gradually evolved. The acceptance of holistic principles in mainstream health and psychological practice gained momentum through key developments. Most notably, the National Conference on Holistic Health held in California in 1975, followed by the establishment of the American Holistic Health Association and the Holistic Medical Association. This milestone helped formalize and legitimize holistic health as a respected field within the Western healthcare systems. Next, let's proceed with the goals of holistic therapy. So, first is to enhance self-awareness and emotional understanding. So, tinutulungan ito na mas makilala pa ng tao ang kanyang sarili kung ano ba talaga ang nararamdaman niya, kung saan nanggagaling ang mga reaksyon, at kung paano ito nakaka-apekto sa kanyang buhay. Next is to reduce psychological distress and dysfunctional behavior. So, layunin nito na mapagaan ang bigat sa kanyang puso at isipan, mabawasan ang anxiety, stress, at maiwasan mga gawaing nakakasama sa sarili o relasyon sa iba. Next is to promote personal growth, resilience, and adaptive coping strategies. So, tinutulungan ito ang tao na mas maging matatag sa gitna ng hamon ng buhay at matutong humarap sa mga problems nila at mas maayos at maging mas positibo. And lastly is to integrate fragmented aspects of the self for improved mental health. So, pinagsasama nito ang isip, emosyon, katawan, at espiritu para maging mas maayos ang mental health at mas magaan ang pakiramdam sa araw-araw. Next is the techniques used in holistic therapy. First, we have mindfulness and relaxation exercises for stress management. So, dito, pinagnginilay yung mga client para kalmama ang katawan at isip. So, nakakatulong ito na bawasan ng stress at overthinking. Next is the cognitive restructuring to challenge irrational beliefs. So, dito, tinutuwid yung mga maling paniniwala o negative thoughts para mas maging realistic at healthy ang pananaw ng isang tao. Third is the exploration of past experiences for insight and healing. So, dito naman, tinutukoy at inaunawa yung mga karanasan sa past na maaaring makakapekto pa rin sa emotion at reaction dito sa present. Then, we have the emotion-focused intervention to process unresolved feelings. Dito, tinutulungan yung client na ilabas, kilalanin at tanggapin ang mga matagal nang nakatagong emosyon tulad ng takot, galit at lungkot para matulungan sila sa kanilang healing journey. We also have behavioral activation and skills training for practical change. Dito naman, tinuturo yung mga concrete actions at coping skills na makakatulong sa pagbago ng ugali at pag-improve ng daily functioning. So next up is the core principles in holistic therapy. First, we have the interconnectedness of mind, body, and spirit. So, holistic therapy asserts that all aspects of a person influence one another and must be addressed together for true healing. So, sa madaling salita, kapag may problem ka sa isip, pwedeng maapektuhan ng katawan at emosyon. So, kaya sabay-sabay dapat itong alagaan para mas gumaling ng as a whole. Then, here, treatment is tailored to the client's unique needs, values, and belief systems rather than following one-size-fits-all model. So, bawat tao ay naiiba. So, iba-iba ang pinapahalagahan, background, at pinanggagalingan. So, kaya iba-iba rin ang paraan ng pag-heal sa sarili. Then, we have the self-awareness and growth. The approach encourages mindfulness, self-reflection, and emotional awareness as pathways to personal development and healing. So, dito, pinapalakas nito yung kakayahan ng tao na magmuni-muni, kilalanin ang nararamdaman at gumawa ng positibong pagbabago sa sarili. So ngayon, kilalanin natin yung mga major contributors and influencers ng holistic therapy. First, we have Hippocrates. He is considered the father of medicine and also introduced the foundational idea that health depends on balance within the entire person. So, not just isolated symptoms. So his writings emphasize that health is achieved when the body, mind, and environment are in harmony, foreshadowing holistic models of care. So for example, he advocated for treatments like diet, exercise, massage, and baths to restore equilibrium rather than simply targeting a single pathology. Next, we have Abraham Maslow and Carl Rogers. So Maslow developed the hierarchy of needs and the concept of self-actualization, suggesting that individuals strive to fulfill their potential once basic needs are met. While Rogers advanced person-centered therapy, emphasizing that therapeutic growth occurs through an environment offering genuineness, empathy, and unconditional positive regard, so thereby supporting each person's path toward becoming their fullest self. Together, their humanistic perspective influenced holistic therapy by highlighting human beings as a whole, dynamic entities with inherent capacity for growth rather than mere collections of symptoms. So lastly, we have Linnea Smith Crawford. She is a licensed holistic therapist and educator. She advocates for integrating spiritual, cultural, communal, and energetic dimensions into healing practices. Next, let's find out the common modalities in holistic therapy. So, holistic therapy incorporates a range of intervention that aims to address the whole person, the mind, body, spirit, and environment. First, we have the mindfulness and meditation. So, these modalities emphasize the present moment awareness. So, it helps individuals to observe thoughts, emotions, and bodily sensations without judgment. So, they support emotional regulation, stress reduction, and the cultivation of stress awareness. making them central to many holistic practices. Second, we have yoga. Yoga integrates physical postures, breath work, and often meditative components. So, it fosters physical strength, flexibility, and bodily awareness while also supporting emotional and spiritual well being, embodying the mind body connection that holistic therapy emphasizes. Next up is the art and therapy music, or the music therapy. Creative expressive modalities such as art and music therapy enable clients to explore feelings, memories, and self-concepts in non-verbal or symbolic way. So these forms are particularly valuable when verbal expression is difficult and aligned with the holistic principles of nurturing the creative and spiritual dimensions of human experience. Lastly, we have the nutritional and lifestyle counseling. So this modality addresses the physical and lifestyle side of holistic healing. So here we have the diet, gut healing, sleep, exercise, and daily routines. So counselors may guide clients to adopt nutritional changes or lifestyle adjustments are part of a comprehensive healing plan. So it recognizes that physical wellness supports psychological and spiritual health. As is the energy-based practices. So, for example, the Reiki and acupuncture, so energy-based modalities view the person's energy field or vital life force as central to health. So, practices like chakra balancing or sound healing aim to restore energetic balance, thereby enhancing physical, emotional, and spiritual well-being. So, kailan ba ginagamit ang holistic therapy? So, it is used when individuals face health concerns spanning biological, psychological, social, spiritual, and environmental dimensions, or when conventional treatments don't fully address lifestyle, emotional, or spiritual factors. Now let's proceed with the pros and cons of holistic therapy. First, it promotes stress reduction, better illness management, and enhanced quality of life. Second, it has fewer side effects and empowers individuals with tools and habits that they can use daily. Third, it embraces a whole person approach, treating mind, body, and spirit, not just symptoms. So while holistic therapy offers broad integrative benefits, it also faces meaningful critics and limitations. First, in the cons, it has lack of it lacks standardization. So, iba-iba yung paraan ng bawat practitioners. Kaya, mahirap sukatin kung alin ba talaga yung pinakamabisa at kung paano ba dapat ito gawin ng tama. Next, it has limited empirical evidence. So, mayroong ilang holistic practices na kulang pa at wala pang matibay na scientific evidence. Kaya may mga health professionals na hindi pa handang tanggapin ito bilang pangunahing treatment. Moreover, holistic therapy has accessibility issues. So dahil minsan mahal, matrabaho at mahirap hanapin ang tamang practitioner, hindi ito madaling ma-access para sa lahat, lalo na sa mga low-income communities. Next, it has complex and overwhelming approach. So, kung minsan dahil sa maraming aspects na dapat i-consider, it might be overwhelming para sa client at therapist. At dahil dito, hindi na natututukan ang pinaka-ugat ng problema. So lastly, let's discuss the emerging trends in holistic therapy. So, ibig sabihin, nagbabago at umunlad pa ito habang tumadami at tumataas yung research at nagkakaroon ng interes sa mga tao sa wellness. First, energy healing goes mainstream. So, dati parang mystical at weird lang tignan ng energy healing. Pero ngayon, mas sinatanggap na dahil may mga pag-aaral na tumitingin kung paano ito nakakatulong sa stress relief at healing. Next, focus on gut health and mental wellness. So, a growing body of research highlights the gut-brain connection, showing that gut microbiome health influences emotional and cognitive functioning. So, holistic therapy is responding by comparing functional nutrition, such as the probiotics, prebiotics, and dietary changes, with mindful practices to support both psychological and physiological wellness. So, these developments indicate a shift toward integrative care that bridges nutrition, lifestyle, and mental health. And that wraps up the major themes: positive psychology, humanistic psychology, integrative therapy, and holistic therapy. Up next, we'll look into the different issues in a counseling practice such as multiple relationships, sexuality and attractions, and the roles of the RGCs and clinical psychologists. The next reporters will take it from here.
Good day, everyone. To continue, let us talk about the issues in the practice of psychology. The one issue here is multiple relationships. So let us start with what it means, why it matters, and how psychologists can manage it ethically. So according to the APA Ethical Code 2017, a multiple relationship happens when a psychologist has more than one role with a client or someone close to the client. So for example, kung counselor ka ng isang student, pero later on, naging family friend mo na rin siya, so that's already a multiple relationship. So these relationships can affect the psychologist's objectivity, competence, or effectiveness, and can even lead to harm or exploitation. So that's why under APA Ethical Standard 3.05, psychologists must avoid any relationships that can compromise professional integrity. According to Black 2017, so there are three types of multiple relationships. First, the non-professional. So ito yung mga social, familial, or business interactions outside ng therapy. So for example, yung psychologist na kapitbahay o churchmate ng client. So common ito sa rural areas. Next one is the professional. So when the psychologist holds more than one professional role. So for example, therapist na siya pero supervisor or researcher din sa parehong client. The last one is the institutional. So it happens in structured settings like the military, schools, or correctional institutions where overlapping duties can blur boundaries. So ano naman ang mga risks kapag may multiple relationship? So first one is the loss of objectivity and judgment. So pwede kang maging biased or emotionally involved. The next one, exploitation and harm. So clients might feel manipulated or betrayed. The next one naman is boundary confusion. So mahirap ihiwalay kung alin ang mga professional at personal. The next one, power imbalance. So client might become dependent or feel pressured. And erosion of trust. So nawawala ang tiwala sa professional at sa profession mismo. So in short, these issues can seriously affect the credibility of the psychologist and the entire field. Let us move on in cultural and contextual considerations. So in the Philippine setting, cultural plays a big role. So because of our values like pakikisama and pakikipagkapwa, psychologists may feel pressure to be close or accommodating, which can sometimes blur boundaries. So this is according to ALPEA 2025. So in cross-cultural studies, it shows differences. For example, in Western cultures, they tend to strictly avoid multiple roles to maintain autonomy. In Ukraine or UAE naman, boundaries are more flexible because of collectivist norms, also known in the Philippines. So in China, the acquaintance society values familiarity. So meaning nito, trust grows when there's some form of closeness. So culture really shapes how boundaries are understood. So what are these current ethical contexts? First, we have telepsychology. So according to Drum and Littleton 2014, with online counseling or telepsychology, multiple relationships can happen unintentionally. So bakit? Because professional and personal spaces can overlap. So for example, flexible schedules can lead to casual conversations. Next, online settings can make clients feel extra comfortable, causing over-disclosure. And the next one, using personal chat tools or social media can blur the line between professional and personal. Plus, yung virtual sessions can give clients a glimpse into your home, which can feel too intimate. So the best practices here is to keep a consistent professional background and attire, and also have to stick to business hours and avoid social media interactions with clients. And the next, current issues in multiple relationships relies on small communities. So according to LADWA 2019, in small towns or close-knit communities, multiple roles are sometimes unavoidable. So for example, a guidance counselor might also be a student's neighbor or relative. So instead of avoiding it entirely, so psychologists should manage it ethically through first, informed consent. So be transparent about possible dual roles, and boundary clarification. So you have to explain your limits as a professional. The next one, open communication. It is to prevent misunderstandings or conflict of interest. So let us move on to management and prevention strategies. So to handle multiple relationships ethically, here are some strategies from different authors. First, according to Amagla 2023, you have to maintain clear boundaries. According naman kay Kelleher 2017, you have to inform clients about your role and limitations. Also, you have to consult or seek supervision when you are unsure. And use ethical decision-making models like Kitchener's moral principles, the autonomy, the beneficence, non-maleficence, justice, and fidelity. And lastly, you have to continue ethical education and self-awareness. So because sometimes yung mga psychologists don't notice the boundaries until they are already closed. To summarize, multiple relationships are not always avoidable, but they must always be managed ethically. So the goal is to protect clients, maintain professionalism, and preserve trust in the psychology-related profession.
So, hello everyone. I am Abisi Hala and I will be the one to report the topic on sexuality and attraction in counseling. So, sexuality and attraction in counseling, it refers to the emotional or physical feelings that might develop between a therapist and a client during the therapeutic process. So, itong feelings na to can arise naturally dahil therapy often involves empathy, trust, and emotional closeness, which sometimes pwede siyang ma-misinterpret as romantic or sexual attraction. However, it is important na maintindihan natin that acting on these feelings is strictly prohibited, pinababawal siya by professional ethics because it violates the trust of the client and creates emotional harm. So, the American Psychological Association, or APA, emphasizes that therapists must maintain professional boundaries and avoid any actions that could exploit or damage the client. For research background, this is according by Pope et al. 2016 and CAP 1999. So, research has shown that experiencing some form of attraction towards clients hindi siya unusual for therapy. Ibig sabihin, normal siya or it is part of human nature. However, small percentage of therapists lang act on these feelings, and those who manage them properly naman, nagre-rely sila on self-awareness, supervision, and ethical training. They found out that marami sa mga mental health professionals admitted to feeling attraction, pero gi-emphasize na professionalism means acknowledging such emotions without acting on them. Risk for therapists who act on attraction. This is according to APA and Baptista et al. 2022. So, kapag si therapist nag-act siya doon sa attraction and it becomes a sexual, or he or she becomes sexually involved sa client, the professional, legal, and personal consequences are extremely serious. Professionally, pwede nilang ma-lose yung license nila, maban sila from professional organizations, and of course, permanently ma-damage yung reputation nila. And then legally, pwede silang masued for malpractice or even criminal charges for exploitation. And then personally, pwede silang maka-experience ng guilt, shame, or isolation from the professional community. So, according to Baptista et al., yung behavior na yun, it destroys the integrity of the counseling relationship and causes severe harm to clients who may feel violated and traumatized. So, the issue of sexual misconduct in counseling, parang naging highly visible siya noong 1980s kasi maraming mga cases of therapists engaging in sexual relationship with clients na exposed sila in the media and in court. So, itong incidents na to, it revealed gaano ka-vulnerable yung mga clients kapag si trust and authority na misuse siya. So, as a result, si APA, they reviewed and strengthened their ethical codes to ensure strict boundaries na ma-establish siya. So, Seto 1995, he or she noted that these reforms marked the turning point for sexual contact between a therapist and clients, clearly unethical and punishable. Important legal cases. So, maraming mga major court cases na nag-shape sa ethical standards in counseling ngayon. Let's say si Roy versus Hartog. So, he's a psychiatrist in New York. He was sued for having sex with a patient. And the court ruled it as a professional malpractice and emotional exploitation. So, itong case na to, it was one of the first to legally define such actions as harmful and unethical. So, impact on ethical standards. So, dahil nga sa growing number of cases and then yung damaging effects, the APA revises ethical standards para i-include yung clear prohibition or pagbabawal talaga on sexual involvement with current and former clients. Ibig sabihin yung nasa current na client and then former clients. So, the APA code now emphasizes that therapists must maintain integrity, objectivity, and focus on clients' welfare at all times. So, yung revision na to, it highlights that yung sexual or romantic contact is unethical regardless sa kung yung situation is na-past na ba or natapos na ganon. So, this change was made to ensure that clients remain protected from emotional harm and that the therapy remains a safe space. So, for example, even if years have passed after naka-receive si client ng treatment or na-end na siya, so the power imbalance and emotional connection from therapy may still make any romantic contact inappropriate. Thus, the new standards strengthen the therapist's responsibility to always prioritize the client's safety and trust. So, ethical guidelines. This is according to APA. So, the APA ethical guidelines provided a detailed instruction to prevent harm and maintain professionalism. So, under these codes, versus sexual harassment, it is strictly forbidden. Then, avoiding harm. It means that therapists must not cause emotional or physical pain. And then, multiple or exploitative relationship with clients, students, or supervisors, explicitly pinagbabawal din siya. So, even with former clients, then, sexual involvement is still considered unethical and therapists must also ensure, of course, informed consent. Dapat aware si client sa therapy boundaries. For instance, if si therapist pwede siya makastart pag-develop ng feelings for a student under their supervision, they must immediately distance themselves or i-refer si student sa elsewhere to prevent exploitation. So, this guidelines serve as a moral and professional map to ensure that all counseling relationships remain unethical, fair, and safe. Outcomes of sexual intimacy. So, when a therapist crosses the line and then nag-engage siya in sexual intimacy with the client, naapektuhan or almost nadadamage yung both sides, especially sa side ni client. So, the client may suffer from a sense of betrayal, shame, trauma, or confusion dahil nga they trusted someone who was supposed to protect them. So, this kind of harm can lead to long-term psychological issues such as anxiety, depression, and difficulty trusting others. So, on the therapist side naman, the consequences include pwede nilang, mawala ang license nila, pwede silang maanan ng criminal charges, and then, ma-damage yung reputation nila. So, for multicultural and social justice consideration, for example, sa Asian or Latin American culture kasi, physical touch, let's say, itap ka nila sa shoulders like this, pwede siya, parang ang meaning niya is to show comfort. Pero sa therapy, yung mga gestures na yun, kailangan siyang i-handle cautiously to avoid misunderstanding or perceived exploitation. And moreover, yung mga marginalized groups like women, LGBTQ+, minors, they are more vulnerable to sexual exploitation in therapy. Therefore, cultural awareness must go hand in hand with firm ethical boundaries and social justice sensitivity. This is to ensure that all clients, they are respected and protected. So, let's pursue sexual attraction in the therapeutic relationship. So, feeling attraction towards a client or vice versa, normal ko siya. It's a normal human experience. But it becomes unethical if acted upon. If nag-act ka doon sa feelings na yon. So, therapists might feel attraction due to emotional closeness, countertransference, or personal issues that remain unresolved. So, the key is how these feelings are managed. It could be through self-reflection or maintaining professional distance. So, therapists must never tell clients about their attraction kasi nasi-shift yung focus away from healing and it could cause confusion or distress. So, managing these feelings ethically ensures both the client's safety and the therapist's professional integrity. And then for training and education, for example, training exercise might involve situations where si client i-express niya yung romantic feelings niya for the counselor, and then this situation allows the students na i-practice mag-set ng clear boundaries and respond para responding ethically. So, pwede rin i-revisit ang APA ethical codes during training para ma-help i-reinforce the importance of informed consent, prevention of harm, and maintenance of professional distance. Kasi through continuous education and supervision, our future counselors can learn that ethical violation not only harm clients but also damage the reputation of the entire counseling profession. That is all. Thank you for listening.
Good day everyone, I am Riza Alimodian and I will be discussing the roles of Registered Guidance Counselor or the RGCs and the Clinical Psychologist. So first, let me introduce the RGCs or the Registered Guidance Counselor and Clinical Psychologist. These two are essential in helping professionals in promoting mental health and personal well-being. While their functions sometimes overlap, they operate under different laws, ethical frameworks, and scopes of practice. This report will be discussing their definitions, roles, key distinctions, ethical foundations, and collaborative functions based on Philippine laws. The Philippine Association of Psychologists, or the PAP, Code of Ethics, and relevant international standards such as the American Psychological Association or the APA, ethical principles of psychologists, and the code of conduct. Um, Next, let's define what is registered guidance counselors or the RGCs. Um, RGCs is defined under Republic Act number 9258 as licensed professionals who apply psychological principles to help individuals achieve optimal functioning in personal, educational, social, and career aspects. And the primary functions are include in providing individuals and group counseling on academic, emotional, and social concerns. Um, administ- it administered and interpreting psychological and career tests to guide um, decision making, and it also designing preventive and development programs such as the stress management, career guidance, and suicide prevention. It also offer consultation services to teachers, parents, and administrations to support learners' growth. And the ethical principles, it emphasizes confidentiality, informed consent, and competent caring. So RGCs must uphold at least a master's degree in guidance and counseling and pass the PRC licensure examination. Next is how about the definition of clinical psychologist? Clinical psychologist is the branch of psychology focused on assessment, diagnosis, and treatment of mental, emotional, and behavioral disorders. So, the roles of clinical psychologists include conducting psychological testing and diagnostic evaluation to determine the client's mental health condition. Um, Developing and implementing evidence-based interventions such as the cognitive behavioral therapy or the CBT and humanistic approaches. Working in hospitals, clinics, and private practice and academic institutions, often as part of interdisciplinary terms of the clinical psychologist. So, clinical psychologists also engage in research and supervision to ensure high quality psychological care, and the ethical standards for clinical psychologists are beneficence, non-maleficence, fidelity, and integrity, ensuring the client's welfare and confidentiality. Um, Clinical psychologists in the Philippines are regulated under the Philippine Psychology Act of 2009. It requires a license and graduate level graduate level training. And next, let's discuss the key difference between RGCs and clinical psychologists. So their key difference in aspect in primary focus, registered guidance counselor or the RGCs. Um, the primary focus is guidance, adjustment, personal growth, and career development. While the clinical psychologist naman is mental disorder assessment, diagnosis, and psychotherapy. While in work setting, RGCs are in educational institutions like, for example, the schools, universities. While the clinical psychologists, they were working in hospitals, clinics, private practice, and community centers. Um, And also, in work setting, the RGCs are dealing with students, parents, teachers, and employees, while the clinical psychologists are dealing with the individuals or groups with psychological disorders. And the legal basis for the registered guidance counselor or the RGCs are RA 9258, the Guidance and Counseling Act of 2004, while the clinical psychologists is RA 10029 or the Psychology Act of 2009. And the ethical code for registered guidance counselor or the RGCs is PAP Code of Ethics in 2017, while in clinical psychologist, APA Ethical Principles on 2000 and 2025. And the intervention level, the registered guidance counselor are only for preventive and developmental, while the clinical psychologists, they are in remedial and clinical. For their assessment scope, the RGCs are for career and personality testing, while the clinical psychologists, they were in psychopathology and clinical diagnosis. So next, let's discuss the overlapping roles for both of them. Both of them aim to promote psychological well-being through counseling and assessment. Both of them also uphold ethical practice, confidentiality, um, respect for human dignity. And the RGCs, may refer clients with serious mental health issues to clinical psychologists to ensure the proper case management and holistic care. The both of them also contribute to the mental health ecosystem under the uh, Mental Health Act of 2018 and working collaboratively in multidisciplinary themes. So next is the Ethical Foundation Register for Registered Guidance Counselor. It is guided by the Code of Ethics for um, Registered Guidance Counselor under the Republic Act number 9258, which highlights confidentiality, informed consent, and competent caring. Competent caring. And the clinical psychologist naman is governed by the PAP Code of Ethics. Um, it adapted from the APA Ethical Principles on 2025, emphasizing the beneficence and non-maleficence, or the doing good and avoiding harm, the fidelity and responsibility, upholding trust and professional accountability, while the integrity is promoting honesty and accuracy. For justice and respect for people's right and dignity, it ensures or ensuring the fairness and human respect. So, in conclusion, the RGCs and clinical psychologists are vital in addressing individuals' emotional, behavioral, and psychological needs. While their roles differ, um, they share a unified commitment to uphold ethics, promote well-being, and respect human dignity. Um, in the evolving landscape of counseling practice, collaboration between the RGCs and clinical psychologists ensures that uh, both preventive and therapeutic aspects of mental health are addressed effectively and effectively and ethically.